Natural relief for severe menstrual cramps. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I want to show you today a couple ways that you can help yourself if you have debilitating or very severe menstrual cramping and menstrual pain. So this video is for anybody out there that just feels like their life has to come to a severe stop every single month because they have pain, they're feeling like they can't go to work. You may feel like you're stuck in bed and that you can't really do anything to relieve the pain. So I want to give you two techniques today. One is going to be a technique, a myofascial release that you can do for yourself if you have the energy and if you're able to. The second technique I'm going to show you is how you can have a helper at home help you with your pain. So we're going to start with a little anatomy because I want you to know where we're going here on this bony model so I can show you on my real model. What I'm going to do is guide you through how to place your hands at the lower abdomen over the uterus and the reproductive system. So you'll be on your back, and what you're going to do is just take your hands and you're going to place them over top of this lower abdomen area. And I'll show you this on top of my model's clothing, and then I will guide her through the actual technique. Okay, so we're going to be just generally going over this lower abdomen. So we can see here as we look from the front side, the pubic bones, we have the bladder, then your uterus sits here, and then the rectum is there. So I'm going to show you this with my model being on her back so you can see as I tilt this that we're going to be accessing this area where the bladder and the uterus are in the lower abdomen. All right, to get started with this myofascial release technique that you will do on yourself, what you're going to do is just create a V with your fingertips. And you're going to just bring your fingertips together and you're going to just, create a triangle there. What you want to do is you're going to find the pubic bone with your fingertips, okay? And you want to just be right above that. Your hands are going to be spread out like this so that one hand is just along the inside of this hip bone and the other hand is along the inside of that other hip bone. So you should be able to feel bone underneath the fingertips or very close to them, and also bone on one side of that hand and the other bone on the other edge of the other hand. So her hands are going to be like this. I'm just showing you so that you can see from the outside, but I want to talk to you specifically about how to do this technique for yourself. So we'll get started. So for this myofascial release, what you want to do is you want to make sure that you are on skin. You don't want to do this over top of clothing because it will not get you the results that you're looking for. So what I'm going to have my model do here is just pull up her shirt here, and I'll have you go ahead and create that triangle with your hands, and I want you to slide this part of your hands underneath your waistband so that way you are in contact just above your pubic bone, and then you should be able to feel here your hands on either side of your hip bones. Okay, so I'm going to walk you through this. Basically what we want then is you're just going to have nice soft hands, and I want you to imagine that you're on a beach and you're just letting your hands sink down into soft sand. That's the amount of pressure. I don't want you to necessarily be pushing a lot. Remember, if you have severe cramps and pain, you're not going to want to be pushing anyway. So just be reassured that this does not require a lot of pushing or a lot of force. In fact, the more gentle you are and the softer you are, the better results you're going to get. So now all she's going to do is she's going to sink down and she's going to come to a natural stop where the body just feels like, okay, that's enough without having to push. From there, without sliding on the surface of your skin, what I'm going to have you do is gently pull hands up towards your head and imagine and feel it almost like an elastic string or an elastic band that you're stretching out. And you're going to feel the stretch of the skin, but don't slide on the surface of your skin. Okay, so if you are starting to slide, that's where you stop. So you definitely want to do this without any kind of massage oil. It is not massage. We are doing something called myofascial release. She has sunk down and she is pulling up, and that's where she's going to wait and hold. When we do myofascial release, it takes 90 seconds to 2 minutes for the release to start to occur. So what you're going to feel is a softening underneath your hands. And you might notice one hand sinks down a little bit more than the other, or one hand pulls up a little bit more and has more give than the other. Trust what you're feeling. If this is brand new to you, you might feel You might not trust your hands and you might be feeling that you're not doing it right. It takes some practice, but stick with it. And again, trust your hands. And then after you start to feel that softening, I want you to continue to follow the body where it wants to go. Meaning if your hands sink down a little bit more, trust that that's what your body needs. If your hands glide up a little bit more, almost like you're taking up more of that elastic band, trust that. But ideally, I want you to hold this for, if you can, 5 minutes or even a little longer. At a minimum, I want you to hold for 3 minutes. And the reason I say 3 to 5 minutes or longer is that we know based on studies about fascia that it takes up to 2 minutes for anything really to start to occur if you're doing it correctly. So we want to give your body enough time to actually make some changes. But with the studies that they've done, they've also found that around the 5 minute mark, your body releases something called interleukin 8. It's an anti-inflammatory. So it's like your body makes its own ibuprofen. We want to stimulate that. And that's why this is a natural way to relieve some pain. So I want that coursing through your body. I want your body to be bombarded with that so that it helps with your pain and inflammation. So give that a try. Now, I will say as a bonus to this, if this is too much, if you have such severe cramping or you're really weak and this is not something that you're going to be able to do, you can have a helper help you with this step. Okay, this is a bonus because I also have another way a helper could help. But let me show you really quick what I mean by that. So to do this, if you're the helper of a person that needs a little bit of assistance, you would just come up underneath here, underneath the waistband. Again, you want to be on the surface of the skin. And you can do that same technique where you sink down and then very gently take up the slack. And that's where you wait and hold. I showed that pretty quickly for you, but it's the same concept. And with that, for the helper, I would recommend that they're facing toward your feet versus the other way. It's going to be a lot harder, okay? The second technique is how to have a helper help you out. I will say with the women that I work with severe menstrual pain, this can be really good because they get a lot of tightness into the hips, the back can hurt, in addition to all of the pain up here into the abdomen. So this is a great myofascial release to get all the way up into there as well. So with you lying down, because you're the patient or you're the person receiving, your helper is going to be standing at your feet at the end of your bed. What I'm going to do is just take a hold here, right underneath the ankles. And what I want to make sure as the helper is that I'm not squeezing. There's not a lot of cushioning here into the ankle. So if you're the helper, just make sure that you're lightly holding on to the legs. And you can cup the ankle here, the heel bone, or come up just a little bit higher. And for the helper, you just want to make sure that your feet are about hip width apart. And all I'm going to do here is keep my elbows straight, and I'm just leaning back. So if you're anybody that's done any type of like water skiing, the same thing. You're letting your body weight just take you with it, and you're just leaning back, and all I'm doing here is doing a little what we call traction. So even though my hands are here at her ankles, really what I'm doing is I'm releasing and causing an opening all the way up into the pelvis and the lower back. And sometimes people can even feel it all the way up into their head where they feel a release happening. Same thing goes with this. It's a myofascial release. So just be patient with this. And that's why I want your arms to be straight as well, because if you are trying here to pull, you're going to get tired. If you're holding this for 3 to 5 minutes or slightly longer, you could possibly get tired if you're doing it incorrectly. So for me as the helper, this feels really comfortable to me. It feels easy. The other thing I will say is just as the helper, see if you can feel that softening going on underneath your hands. Can you feel like the leg is growing a little taller or a little longer? Okay. And you might notice that one side releases different than the other. Again, just trust your hands and what's happening there. And you can get some feedback from the person that you're helping. Ask them how it's feeling. If you're doing it correctly and it's something that's going to help them, they're going to love this. They're going to say, "Oh my gosh, that's really helping me a lot." So give that a try. Again, just don't get in a hurry. Don't do anything sudden, like any sudden jerky type motions. It's very, very gentle, and make sure you're not gripping through your hands. So hopefully that helps you out at home to give you some tools that you can use to help yourself or have somebody assist you at home. If you are struggling with severe menstrual pain and you want a little help and you want some guidance, head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can sit down with one of our therapists and get all of your questions answered and really find out what can be done in addition to things that we can do here at home and things that you can do for yourself. What else can be done to help yourself feel better and get through these debilitating periods every single month? Thanks for watching this Ed Talk. We'll see you on the next one.